Morning. Today is August 4th, 2026. Present with us is Pam. Do you want to explain to us what's going on in your department?
Okay,
Please.
well, in the public health department, we've had some vacancies and some vacations, so we've been running a little bit short staff. Jesse is back after a partial recovery from his surgery, and he's working full-time again. Erin will be back from her vacation this week, and we still do not have a nurse to fill our other positions, so we've been kind of juggling responsibilities for that. Fortunately, we've had very few communicable disease cases the last couple of weeks, so that's been helpful. And between Erin and I, we've been able to manage those and handle those efficiently. We are preparing for a big event on Thursday. We have Dr. Julia Garcia coming to do a cultivating hope training. We had kind of a targeted audience that we wanted there, like educators, first responders, law enforcement, our medical and mental health care providers, faith-based leaders, businesses. So we made a lot of person-to-person invitations for that. We had 50 spots for this, and we've got, as of today, 49 filled. So good turnout. I've been working with Bruce and with IT to make sure we have all of the things that our speaker needs that day out of the volunteer hall. She's got a list. She's a professional, so we've got a list of what she needs. So I'm really hopeful that's going to go well. And I'm pretty excited about that. It's something we've been working with our behavioral health money. And as I've said in the past, we're really kind of looking at how do we create this positive spin with behavioral health. And so we're really looking at cultivating hope. There's science behind it, and it's measurable. So this is going to give us an opportunity to train these 50 people to be trainers, and then we can expand that out into our community with others. So other people in our departments, other people in our community. So I'm pretty excited about that. I'm excited that our schools are going to have this as they start the new year. I think that's a great place for this to be, that our medical providers are. We had a couple of our mental health providers really excited about this training. So I'm excited to report on it next time I come in on how that's going. Also with mental and behavioral health, the Mental Health Local Advisory Council has been working on a new resource guide. This used to be kind of our department's job to put this out. I'm not sure how this changed. I wasn't at the meeting when it was determined that Lindsay Graham from planning was going to take this over. So Lindsay put out this new one. So I've got one for each of you. So that you can kind of look through it. I would say feedback for it would be great. I had them take the health department logo off because we aren't the ones producing it anymore. It gave us room to kind of focus on the 988 number on the front. So if there are things you see that maybe aren't in there that maybe you think should be, or if you need to use this to help folks in the county, we give them out at events. We give them out in our office when we talk to people and they need resources. So they are pretty handy. Of course, anytime you put something down on paper, it can become obsolete and expire, but there's a date on the front of it. So as it's updated, there'll be new versions. So anyway, this is hot off the press in July, so just a couple weeks old. So I thought it might be helpful for you to have that and take a look at it. We have been doing our summer events. So we've done Clancy Days and we did Frontier Days in Whitehall. We're preparing to do the fair in August. And we've been doing our no cost raffle and talking about our services. And we've given out 2, and it'll be a third, 2-person 72-hour emergency packs. That's within our grand prize. We have a mental health wellness pack or basket that we do, an infant one that has a safe sleep sack, and we talk about safe sleep And we've done a child pack, and it gives us an opportunity to talk with the community about the services we provide and things we do. But the emergency packs are really popular and people have been excited to get those. So we have one more to give. We did get a grant from Montana Public Health Institute to buy those 3 packs. And it was a community engagement grant that we used to purchase that and to promote that. Jesse's done some YouTube videos that we've put on our social media and out on our YouTube channel with information on that. We've also been working a little bit lately with getting some information out about wildfire smoke, just because we can see it and breathe it. So we've been getting a little information out for that.
Is that on the internet?
We've got it on our social media
Okay.
site. So yeah. Let's see, what else are we doing? Well, we're starting to do some cleanup and things with our supplies and our sheds and our satellite buildings so that we can get ready for building expansion. So I don't know if there's any new news on that, but we're trying to prepare and get ready because we're excited. So
Dan just signed the buy-sell, so we're getting closer.
okay. Is the
Yeah.
county attorney back in town?
Yep.
He is.
Okay.
Far as I
So,
know.
sorry, yeah, I
I
haven't.
think it was Friday when I talked.
Yeah.
His
Alright.
car there was there listening, so.
So, really, that's pretty much it. It's been pretty busy just being shorthanded and
Yeah.
trying to, cover things that we need to cover. So that's pretty much my report. We're gonna help with the the employee health event next week. We'll be there to help. We've done some meetings with the insurance folks and with Kelly to get more information out and to get the registration so that it's a little more organized so that we can do that. The event is going to be in the high school and we've worked with them to secure that building. So we kind of outgrew the volunteer hall last year when we added the biometrics. So this will provide a little more privacy for people. So hopefully people know where to go. Maybe we should put a sign on the volunteer hall door or something to go back to the high school. But so we're doing that next week. So that's the big stuff for health department. Look at that. I'm a minute under.
Good question. On this, where was it that they obtained their information? The reason I ask is like transportation. I'm not sure honestly where Whitehall Public Transportation is at this point.
So when the health department did this, we made phone calls to all the numbers to
Okay.
make sure that they were correct. I'm not sure if Lindsay did that when she updated this. But that was what we suggested, is that, making person-to-person contact with them before we put it in. One of the things I asked about, you'll notice there's a website for mental health. And I one of the things I've requested is that we have a way to highlight our own mental health providers to and not resource things outside for everything. I'm not exactly sure how to do that so that we don't miss people. But Crystal Kishba is on that committee, and I think she can probably provide some information for us on how that might look. So it's not going to be exactly perfect ever, but I think it's a good place to start. And I would say, the county health department is on here. So I would say if it's a health need and you're not finding what you need, call us, because, that's what I would tell people is call us so that we can help, find the resources you need.
One suggestion I would have is like have Boulder, Whitehall, Montana City, instead we got Whitehall here, then Boulder, then Whitehall, Boulder. It's kind
To
of,
group them.
it's all.
And yeah, and I think it's good for users to provide comment back. And so our mental health LAC meeting isn't next week, it's the following week.
And you're also missing
On the
Montana City Dental.
20. Yeah, there's stuff that's not on there. So if you've got feedback, I would really encourage you to send it back. Our mental health LAC meeting is on the 20th. And that's partly why I've given them to others to look at, so that we have eyes other than ours on them. We have a little bit of feedback too from our department after using them for a few weeks, so.
Looks good. Yeah, that'll be a nice little resource.
Well, I kind of pushed to get them out, because one of the things we do as school starts is we give these to all our schools. We give them to our long-term care facilities and our medical providers, because in the fall, we always go around and talk to them about reporting communicable disease and do a touch-in with them, a face-to-face. And we give them a little folder with the stuff we, have to give to them, and we put those in. So, and I know some of the schools are always telling, do you have more of those resource guides? So I think they're used.
Yeah, they're handy for
They are.
finding stuff you usually can't find in the phone book or online.
Right.
So,
And like I
Okay.
say, some of it changes, but we're on there. So if, people are struggling, they can call us and we can try to help resource them too.
yeah, well, that's good. How are you doing on your nurse, search?
We had the one applicant who decided to decline because the pay scale wasn't what she needed. Erin said she had a nursing friend who asked about it, but I haven't seen another application.
Okay,
So I don't know.
just waiting on
Yeah,
applications.
I kind of been thinking, what can we do? And I know a lot of other jurisdictions our size don't have all the nurses we have. So the things that aren't clinical are done by other people. So that's an option if we can't get a nurses to look at, hiring somebody that could do some of the other work, to give us more resources. Whether that is expanding that behavioral health position and, giving that position more duties if, our behavioral health coordinator is wanting that, or looking at another part-time position. So I've been thinking about it, but
You still have opportunity for internships?
I didn't do a summer intern this year. Because I was kind of wild with stuff. But next year we're gonna be doing probably a community health assessment again,
Okay.
starting that. And so, yeah, I'd like one. In fact, my granddaughter was here and she just graduated from high school, and she came over with me yesterday because I needed to take care of some stuff, and I gave her a job to do, and she said, "Oh, so I get to work for you?" And I said, "Actually, I do summer interns." She said, "Could I apply for that?" I said, "I don't know about nepotism, but."
Yeah.
But anyway, I would like to get one again next summer, just because I have some projects that I think would be really helpful to have an intern help us with.
Good.
So yeah, I would like to look at that for next summer. So we would probably start advertising in about April, get those kids as they get out of school. And if you know somebody who we know often works better than what we know, so.
Yeah, I think we've got the deadline for closing at the end of September, but we should close way before that. I think all we're caught up right now on is the deed restriction, and I think we've got that about nailed down. We got one question on it. Once we get that done, then we should be able to close on this building. Once that happens, then we'll probably figure out how we're gonna design for there. And then we can start bidding. It'll be perfect to start bidding over the winter, because we usually can get better bids over the winter on a
Yeah.
project.
I guess one of my questions is, is this gonna impact me during respiratory season? And I'm fine to move forward, I just wanna move forward. But if my building's gonna be, in flux during that season, I need to make plans to vaccinate in different ways.
I would say the soonest we're even gonna touch that building would be in the spring. I mean, it's
Okay.
gonna take a while to get
All right,
it designed, get it.
I'll take
bid
that
out.
off my worry plate.
Yeah,
then.
no, it would be spring, summer probably.
I'm sure.
And that would be fast, I think, for what we're needing to do.
Yep.
A lot of coordination. Well, also, once we get once we get ownership of the place, we're gonna have to reach out to Intermountain and get figure out what their plans are, if they're gonna redo their contract, I think is up next year or something. And if they're not
It's
moving forward,
20, yeah.
looking for a different provider of some sort, so we got stuff to do as soon as we actually own the building, so.
Well, and I know that side would like to talk with us in the planning stages too, about what's happening.
Yep.
And some of what I've got planned might affect their side, so I think we need to include them in how
Oh,
that
absolutely,
looks.
yeah.
Cause we want to keep them happy.
Yep.
Keep them there.
Yeah, especially if they wanna renew their contract, I mean, if they say, nah, we're not gonna do it, then I don't think we have to
And we'll
waste
look
much
at it in a
time.
different way, yeah.
Yeah, we're not gonna waste much time with.
Well, it's, in fact, my granddaughter's boyfriend was with us and he's going into pre-med and has an EMT license, so he was really excited to come to a rural place and look at all that stuff, and they were gracious enough. Veronica talked to him for a little while,
Oh,
and
nice.
he had a lot of questions, and, you know, one of the things that she said and I said was how much we appreciate that partnership between us. He said, well, do you guys vaccinate down here? She said, no, we send them down the hall to, you know, so we talked about that partnership we have between the medical and public health side, and it is one of my main reasons for wanting to be in that place is to keep that, so,
No,
yeah, I
absolutely.
hope we keep a medical partner in there.
Oh, yeah, that's our goal.
Mine too. All right, did I answer your question? Any other questions? Well, thank you for supporting us, I appreciate it,
Guess we'll be adjourned on this.
Thank you for your good job, man.
thank you.
I got something for you.